George, for that very comprehensive piece. And because it's a very comprehensive subject and it's a really massive thing that's happening right now, we would like to help break down exactly what happened today means to you. Now, the Universal Health Coverage bills signed into law by the President today and getting officially launched during the Mashujaa celebrations tomorrow in Kericho. This is what's happening. So you might be wondering what exactly the President has signed and what it means to you. So basically, the government is trying to provide essential healthcare services to everybody without financial hardship. So the need for quality and efficiency in the improvement of the Big Four agenda, the four big elements or pillars of the UHC is what the President signed today. First, the bills in a little bit more detail. We had the Primary Healthcare Bill. That's the first one. The Primary Healthcare Bill 2023. And this provides a framework for primary healthcare services. Basically, this is how the national government can send resources to the county governments in order to have primary healthcare looked after. That is a Primary Healthcare Bill. Next, we had the Digital Health Bill 2023. Now, what this basically means is that it's creating a platform for health data like patient records and all this information to be available and to be integrated so that you can be able to get better services no matter where you go. Third is the Facility Improvement Bill of 2023. Now here, this basically means it's to help improve the health centers, the health facilities. And this is how they do that is by allowing the health facilities to retain any monies that they generate through their services. And number four, we have the Social Health Insurance Bill. Now, this one seeks to establish a social health insurance scheme with 3 new funds. And this is where a lot of confusion is. First, we have the Primary Healthcare Fund. This one is focused on the universal healthcare coverage for key health services. We're talking maternal, neonatal, and child health service. This is, of course, the Primary Healthcare Fund. Okay, remember, NHIF is splitting into 3. That is, a National Health Insurance Fund is splitting into 3. And the first is Primary Healthcare Fund. And this is going to cover things like maternal, neonatal, and child health services. This is very, very foundational. Second, we have the Social Health Insurance Fund. This is going to look at social insurance, so to speak. Now, we as Kenyans will be able to contribute to this at about 2.7% of our income. And the minimum, of course, the minimum contribution will be about 300 shillings and the maximum will be capped at 5,000 shillings. And finally, we have the Chronic Illness and Emergency Fund. This one is, as the name suggests, specifically focused on critical illnesses or chronic illnesses like cancer and diabetes and others. Now, understandably, this is a big subject and we shall be breaking it down for you as we proceed. And keep an eye out for what's going to happen tomorrow at the Mashujaa Day celebrations in Kericho County, the Green Stadium, where we will actually be having a much more impactful coverage. There will be a lot more detail that will come out from the President and his government, and our people are there ready to supply any needs you may have in terms of understanding of this, not just tomorrow, but in our subsequent bulletins. Let us know where you're watching from. Let us know if you truly understand what the government has signed today into law in form of the President. And let us know if you have any concerns of the splitting of NHIF into 3 different funds. Now, shall we move to other matters?